office. Sorry. This team is tasked with assisting MPD officers as well as civilian employees. This team's primary goal is to help peers within the MPD sustain good mental health, which in turn helps to provide a healthy working environment. Additionally, the Community Crisis Intervention Team assists with community-related mental health concerns, responded to citizens whose mental health is of concern, and to individuals who are in crisis, many of whom are experiencing homelessness. Representing the team today is Corporal Tinker, who has been a part of the team for 8 years, Corporal Luckie, and Correctional Officer Harris, who have both been a part of the team for 2 years. Other members of the team are Major Armstead, Lieutenant Johnson, and Officer Lamar and Officer Dozier. And I just got a message that all of the team is not here. I think, let's see, which one is here?
They're probably at the crisis center.
So I think I saw
Corporal Luckie's here.
Corporal Luckie. Good afternoon. I thought
Yes.
I saw Corporal Luckie.
The camera, the computer is on, but maybe he stepped away from his desk.
Well, I just got a message that they are here. So whomever would like to speak for the team, please feel free.
We could also go ahead to Lee McMichael, and I can send a message to Corporal Tinker and
Okay,
Corporal
so
Luckie.
what they're telling us is that they're having a little trouble. So we will go ahead and move on to Ms. McMichael, and then we'll let the team work on their technical issues, and then we'll come back to you if that's okay. So I will go ahead and introduce Ms. Lee McMichael. She's a clinical social worker therapist serving part-time as an adjunct member of Auburn University of Montgomery's faculty. She is also in private practice as a counselor with Pike Road Counseling, continuing a work history in counseling practice that began in 2008. When she lived in Bowling Green, Kentucky area, Ms. McMichael moved to Montgomery in 2020, 6 months into the COVID pandemic. The only Montgomery she has ever known has been one coping with a public health emergency, and this has certainly affected her work and her concerns. Skilled in social work and community development, Ms. McMichael is eager to network with others in Montgomery on mental health, wellness, and is also generous with her insight. Good afternoon, Ms. McMichael. How are you?
Good afternoon, Gandhi. Thank you for that fantastic introduction. I appreciate it. You know, you mentioned that I moved in 2020 in the middle of a pandemic, and I think that is a story that I hear often, is that in dealing with the pandemic, so many people are dealing with other major issues, crises, challenges on top of it. And so when I talk about the mental health aspect, the effect that COVID has had on mental health, I think we really have to kind of step back. It's like, you know, this whole world of a pandemic and all of the challenges in it, including, you know, political and social justice issues that have certainly contributed to the uneasiness that everyone's been experiencing. So in light of all that, a move seems pretty minor, but it certainly adds to it. I think the information that we have now on how COVID has impacted mental health is really just the tip of the iceberg, even though we're 2 years into it. but it's definitely provided a wake-up call that mental health really needs to be a priority. There needs to be more resources, more providers, better access, and we need to do a much better job supporting the population's mental health and the providers that that support those populations. So I was thrilled to hear Miss Leslie speak that Alabama really has kind of acknowledged that challenge and is putting more funding into it. But at this point, we've seen about a 25% increase globally of depression and anxiety symptoms. And I don't think that that really captures the true picture of what we're dealing with. As far as our country, over 30% of adults right now are experiencing mental health issues and concerns, with Alabama being one of the highest at 34%. I think the pandemic has certainly kind of helped with the stigma around mental health. It's made it more relatable. People kind of have an understanding because experiencing it brings about that understanding. But I also think that it's creating kind of a more intense situation for our mental health providers. As again, Miss Leslie said, she had a month-long wait list for intakes because there were not enough providers. And then of course, the pandemic shut down access to that. We had to quickly shift online. So there's definitely been, I think it's been, again, that wake-up call that mental health needs to be a priority. And even though we're coming out of the pandemic, what I'm seeing is an increased number of people seeking services. And I don't know if that's because now services are more, are open and doors are open now, or if it's because people are realizing that as things get back to normal, they're coping and struggling. Their coping has not gotten back to normal, and they're still dealing with significant challenges. I think the one major explanation for kind of the stress is the social isolation, and that has caused a lot of strain on our special populations, on all populations. But being cut off from family members, supports, our medical care, we've seen an increase in chronic illness, drug use. There's certainly been financial strains as people have struggled with work challenges, losing work, or not being able to go into work, and that's caused an increase in homelessness issues, and certainly kind of pulling more on the system for resources, including food supports, electricity supports, all of those things. So as a practitioner, what's been particularly interesting to me is that this is the first time that we're dealing with a massive crisis on a macro level that I'm also in the middle of experiencing. And so I think that our community members are all experiencing that, whether it's the hospitals, of course, those frontline workers are dealing with a whole different level of stress and exhaustion. But then also our law enforcement, with the increase in criminal activity and drug use and drug overdose issues, there's a certain strain on them. So the impact is widespread, and I think it's going to continue to evolve and grow. And I'm hoping that our communities are looking at innovative ways for supporting each other, for supporting work that agencies like Donna Leslie's does, so that they can continue to provide those services, but that we're also looking at alternative ways to support community members who may not have access to mental health supports, or may be reluctant to seek out those supports. Looking at schools, churches, community centers, and providing some resources in-house, even in nursing homes or assisted living facilities. So I think those are kind of the challenges that we're facing. And of course, those vulnerable populations, like our homeless population, vet population, our elderly population, those have already been, difficult to reach. And this is kind of pulling some attention, unfortunately, away, or some resources away from them and what they need. So I was asked to speak on mental health and the impact that the pandemic's had. And so I just want to kind of keep on track with the time. But that's sort of where I'm seeing as a practitioner and kind of the effects as far as our population.
All right. Thank you so much, Ms. McMichael. We're going to hold questions until the end unless they would like to put the questions in the chat. I do know that there's already been a request, Ms. McMichael, for your contact information in the chat. So whenever you have an opportunity, if you could share that with everyone. Corporal Luckie has called into the space. And so Corporal Luckie, if you all would unmute with *6 and provide us with your presentation. You can do *6.
Good afternoon, Corporal Luckie.
Good afternoon.
How y'all doing today?
We're doing great.
Great. Good, good. We're glad to be here, and we're excited about partnering with you guys. And hopefully we can get this mental health thing under control with the homeless. But we also have Officer Dozier, he's here as well.
Hi, can you hear me? Sorry about the issues earlier. We don't have the best equipment around here. Don't spend a lot of time in the office. So we appreciate you having us on. We're excited about the partnerships that are going on in the area. And our team of law enforcement officers consists of 5 full-time law enforcement officers that focus on the homeless and on people experiencing mental health crises. We have within the team, we focus on different areas. Corporal Luckie focuses on the streets, dealing with both Carastar, assisting them when they need assistance, and also dealing with our officers when they come in contact on various calls for people who may be experiencing a mental health crisis. Everybody else on the team does that as well, but he sort of leads that area. Corporal Tinker and Corporal Harris focus primarily on the jails, the municipal jails. They deal there with people who need assistance when they are released from the jail, teaming up a lot with Carastar. Myself, I just kind of fill the gaps. I actually focus more on the mental health of our officers and also do training in regards to how they can show them better how to interact with people who are experiencing a mental health crisis, show them that there's other ways than just taking somebody to jail, which the officers are desperate for that kind of training, that kind of information. They want to be able to help people. And I feel like the strides that we've made, the progress we've made the past couple of years, our partnership with Carastar and other organizations is really starting to make a difference. So we're excited about the way things are going and what the future holds for our partnerships and what we're able to do to assist the citizen.
All right, thank you both so much for the presentation. We're now going to open up for questions, and anyone can definitely ask a question. Please make sure to raise your hand so that we're not speaking all at the same time. And if you do not know how to raise your hand on Zoom, I'll just go through this right quick. If you look down at the bottom toolbar of Zoom, there's a little smiley flat space with a plus sign. Click there and you can raise your hand. It says raise hand. You just press that like I'm pressing. I went away. Okay, like that. And then we will definitely acknowledge you. So does anyone have Any questions? Eileen, please help me because we have two screens.
Yes, well, I see a question for Corporal Lucky in the chat.
Go ahead.
Please share the level of mental health first aid you're trained to provide.
Just go ahead and say.
Corporal Lucky,
I'm typing in right now. I'm finna respond to y'all.
if you could, you can just tell us the answer. You don't have to
Okay.
type it in.
All right, I'm a certified instructor for the CIT team. I've been trained where I can go out and train other officers and public as well. And everything we do like a 40-hour class to get our instructor license. So it's very intense, and we actually go through different scenarios, actually, people in crisis by actors and everything. So it's intense training. So I am a certified instructor who can train other officers and then civilians as well, if needed.
All right, thank you
Mhm.
for that answer. Donna, I have a question for you in the chat. It says, is Carastar Health intended to develop more supportive housing options for the public?
Would love to. That would take additional funding. I don't know of any grants or anything coming up, and honestly, right now, I'm not taking on any new projects for a little while. Need to get the ones we gotta, that's called biting off more than we can chew, but down the road, if there's more funding, I would love to have far more supportive housing beds than group home beds. Moms, which are semi-independent, are also a really nice option, but it takes funding and it takes some time. So right now we're sticking with what we got, and we'll see what happens in the future.
All right, I do not want to mess your name up, so I see your hand is raised. So please pronounce your name for us and then give us your question.
Yeah, my name's Muad Al-Khattab. I'm with Faith in Action Alabama in the Peacemakers campaign. I wanted to know if I think Corporal Lucky, is it Corporal Lucky?
Yes, sir.
Correct? Yes, sir. I just want to know if you could maybe put your contact information, email, and a phone number in the chat. I'd like to connect with you and actually anyone else. Our Peacemakers campaign is a community violence intervention campaign that we're advocating for, like a publicly funded program. Just kind of has a comprehensive approach to community violence. And so I think one thing when I think of MOC and all the other other services in regards to mental health and all those wraparound services that we would like to partner with. So if I can get your information, I'd appreciate that.
Yes, sir. I'm putting it in the group chat. As of right now, I'm typing to you guys right now for you to be able to communicate with me and have my contact. And that sounds great. Any way that I can help, just let me know.
Corporal Lucky.
Thank you.
Corporal
Yes,
Lucky,
ma'am.
what kinds of public groups do you offer training to, and how long does the trainings take?
Right now, it's strictly law enforcement. We're trying to get all of our officers trained where they'll be able to go out on the street and deal with these people with mental health issues, because number one, if you go out and make contact with a person with a mental health issue, you need to know at least the basics, how to approach them and everything, and how to interact with them, because it's not a 10 or 15-minute conversation. You're gonna have to pretty much figure out what's going on with them and everything, and what solution can we come to help them, because they can be just went through something, they could be on drugs and have mental health issues. So it's our job to figure out what's going on, what can we do. So that's where the CIT team come in at, because most of our officers at MPD, we go to calls back to back, which they don't have time to sit there for 15, 20 minutes to communicate with these consumers. So that's where CIT come in. We have plenty of time where we come out, interact with them, we end up getting them to let us know what's going on. And talking to them in general, like there's someone that started going at them hostile and they're already in a hostile environment. Because it makes a difference how you approach these consumers at any point in time, because you never know their mental status. So right now, we pretty much just trained our officers, all law enforcement right now, but it will be open up to the public later on this year.
And so Corporal Luckie, just a follow-up question to that. When you all interface with the individuals in the community, would you transport them to Carastar if that was needed? Do you take them to the hospital? Like, can you just give us a little more information, what you all would do in a situation?
Well, what we currently do.
Corporal Luckie, you all are on mute. I don't know exactly what happened. Corporal Luckie. Well, we will give them an opportunity to unmute. A question in the chat was, what does CIT stand for? It stands for Community Crisis Intervention Team.
Gandhi, while we're waiting for Corporal Luckie to come back, Cher Graham has offered Gulf Coast Mental Health Coalition, provides training and education programming. Ms. Graham, can you say any more about that? Are you representing that organization?
Yes, hold on.
Corporal Luckie, I'm back.
Yes, I am one of the co-founders and co-directors of the coalition. We are 6 years old, and we can provide any type of training needed. We also have resources within our affiliate members, and we'll work to find the correct type of training for any individual, resource-wise, or group. And all you need to do is let me know what you're looking for. And if we can't provide it, then we will certainly help find the resources that you need to get the education and training that you need. Not a problem. That's what we're here for. We work across the coast and across the United States with so many programs of positive things that are happening related to mental health and crisis intervention training. So be glad to help any way I can.
Thank you, Ms. Graham. And I hear Patrick Luckie's come back.
Corporal Luckie, you were unmuted and then you went back on mute.
Corporal Luckie, can you hear me now?
Yes, we can hear you.
Okay, and the question was, yes, we do transport the consumers to the hospital or to Carastar if needed. We try to, the reason why we transport them ourselves, because most of the consumers do not like to be transported in police vehicles. So I have an unmarked vehicle that I use, which have no decals on it, all blacked out tinted windows, where the consumer feel more safe and less embarrassed when we transport them either to the hospital for their mental disability or to Carastar. So yes, to answer your question, we do transport at all times. Any other questions?
I have a question. This is Cher Graham. I have a question, Corporal Luckie. Do you do the same when you are called for a crisis with a homeless neighbor? Do you use your unmarked vehicle to transport them as well?
Yes, ma'am. I do. If we come in contact with a subject that is homeless, I transport them either to the men's shelter, or the Salvation Army, or the women's shelter. Whatever we can do to help them, yes, I do transport them as well.
Thank you. I think that's a great idea, and it's so much more respectful for anyone to be transported in an unmarked vehicle. Thank you for the work you do, sir.
Yes, ma'am. Thank you, guys. Any other question?
I said it in the chat, but I just want to say, you guys, your team is fantastic, and I thank you every single day.
Thank you too, Ms. Leslie. We appreciate working with you guys and enjoy working with you.
Eileen, have we asked all the questions in the chat?
Yes, as far as I can see.
Does anyone have any additional questions? All right, if not, we would like to thank you all for joining us today. I do know that Ms. Pickett is on, I think, and if she would like to say something, I would yield to her at this time, but if not, we appreciate you all for joining us, and I do know that we will have our next resource hour. This is May, it will be in July, because they're every other month on the 3rd.
Good afternoon, everybody. I want to say thanks for joining in. We appreciate everybody for coming. And we have about 8 minutes left. And I know both Charlene Robinson and Cynthia Bisbee, not to put them on the spot, but both of them work with Mental Health America in Montgomery. And since this is our mental health session, I wanted to see if they had any announcements about anything that's coming up or anything they wanted to share about the trainings that they have on a regular basis. So Cindy Bisbee or Charlene Robinson, do either one of y'all want to pop in and just share some information?
I would like, Charlene can tell us about the roundtables that are coming up, but I would also like for Julie Waters is on here too.
Okay.
And she's working with a new grant that we have. And maybe she could tell a little about that.
And again, the organization is Mental Health America in Montgomery. So Julie, can you take about 3 minutes?
I put her on the spot instead of me.
She is putting me on the spot. Well, I welcome the opportunity to tell you about this project. It's a Brave of Heart grant that we got through Mental Health America. And this grant targets frontline healthcare workers who are not medically certified workers, and to develop a toolkit and to link them with resources that will help them through some of the struggles that they may have witnessed through COVID. And so this is geared towards the nursing assistants, home health care workers, janitors, food service workers, social workers and administrators, the people that worked on the front lines that we don't necessarily hear a lot about. And when you research what resources have been available, there have been little to none for this group of people who, you know, really experience some of the things that the earlier speaker talked about: an increase in depression, anxiety, possibly PTSD. And so we're hoping that this toolkit will give them an opportunity to recognize that they may have some mental health needs, and then to seek out some resources and assistance to meet the needs that they have.
Okay, thank you. Can you give me your contact information so I can type it in the chat as you give it to me?
I can type it in the chat.
Okay, go ahead.
Okay.
Lydia,
Yes,
I have one announcement that I have, and then I can share it with you for you to share with this group. I have a flyer that says Mental Health Action Day, Chalk the Walk. It is requesting that you write an encouraging message on the sidewalk with chalk for those that pass by. That is tomorrow, May the 19th, and just an encouraging message. You can do it, keep going. We'll send the flyer to you so that you can send it to the group. It won't cost anybody anything except for some sidewalk chalk. And it could be a fun event that you can do with the kids.
okay,
So we'll definitely get that information to you and Eileen.
thank you.
Gandhi, I sent you a message in the chat to see if you want to tell about something.
Thank you, Dr. Bisbee. I'm trying to keep up with chat and text messages. But instead of me announcing it, I'm gonna see Tara Marlowe. Are you on with us?
Yes, ma'am.
All right, the Wellness Coalition has an opportunity for some community health worker agencies, and I'll let Tara Marlowe inform you about that opportunity.
Hi, good afternoon, everybody. I'm Tara Marlowe, the program coordinator for our wonderful grant, Southern Alliance 2.0. And yes, we sent out some information about for you all to have the opportunity to show interest in that. And so if you have not, please make sure that you complete that form. We are rounding up that information over the next couple of days. We actually will be doing that training for Train the Trainer for that on next Friday, May 27th, as well as the Friday after that, June 3rd. And those that have shown interest, I made phone calls today, had to leave some messages for some people. But if you need to contact me directly, it's not too late. My email address is tmarlowe@thewellnesscoalition.org. Please reach out to me, or you can contact me via voice at 334-293-6442. The more the merrier. We had a phone call meeting today with our grantees, and they did let us know that they don't want us to have less. They would like for us to have more. So that was exciting news. So yes, for all of you nonprofits out there, COVID-19 awareness and mental health awareness, please make sure you reach out to me to find out more information on how you can get connected with us on that initiative.
Yes, and that is our COVID-19 Train the Trainer program that we have for the Wellness Coalition, as well as some additional mental health training with Mental Health America. And there is some funding attached to that. So please, as Tara said, she'll put her contact information in the chat. And if you're interested, you can reach out to her. And Lydia, that is all that I have, ma'am.
Can I just say one more thing about that program?
Sure.
It's the Wellness Coalition's done this in the past, and some of y'all might have participated. What it does is it takes your existing staff and trains them how to be how to provide community health worker services. And so it adds a kind of health dimension to what you're already doing. I would encourage anybody to get involved in it.
And, Lydia, this is Charlene. I raised my hand, but before we leave, I wanted to have a few moments for a commercial for Mental Health America in Montgomery. I wanted to mention a couple of the programs, the upcoming programs that I think might be of interest for some of the individuals here. We have monthly roundtable, which will start this summer. And the 4 programs that we have that we are planning for this summer, one is about WINGS, what all they do, how they help the individuals with mental illness, a very comprehensive program about what they're doing. Another program that we're looking at is alternative methods for treating depression beyond medications. The third one that we're looking at are the special needs of elders, substance abuse, elders with substance abuse issues. They have many more issues, many more problems than really the younger individuals. And one that we're real excited about is the special needs of offenders coming back into society. What we can do to be supportive of these individuals. And then later in the fall, we plan to yet another program with the ALS organization. Probably it is going to be a death, dying, and grieving. And then in very late fall, early winter of 2023, we plan a rather extensive symposium on art in mental health issues. So anyway, I just wanted a quick chance to give a commercial. And that's all.
There's a question in the chat about flyers, getting emailed flyers. Jackie, do you mean from Mental Health America? If so.
Yes, I do. Yes, I do.
Okay, great. Well, I'm sure, I know that I've seen Mental Health America's website. They have a great website, but if there's anything that Mental Health America would like to send to mock to distribute, that could be done too.
Okay, thank you.
Arlene, I leave it in your hands.
Okay, well, on behalf of Lydia, Mock, all the volunteer leaders that make these committees happen, I want to thank those of you, these speakers today, the Donna Leslie, Lee McMichael, Corporal Luckie, and Officer Dozier, who've been so generous with their time. Thank you so much for also to all of you for being here and bringing your questions and your attention to what they had to say. And we thank you for signing up for this resource hour, and we will be in touch with you about the next opportunity. And we'll also share a lot of these resources in our newsletter. And by registering for this opportunity, you have registered for our newsletter. So thank you for that. You can always unsubscribe if you need to. Thank you so much.
Everybody for being here.
Thank you, everybody.
The next resource hour will be in 2 months, the third Wednesday, same time. Our mock general membership meeting is going to be the 4th Thursday in June at 3 o'clock. And we will probably move from a virtual to either a hybrid or an in-person model for this time. So stay tuned, watch your emails, and you'll get the information as soon as it's settled. Thanks to everybody. We appreciate you and everything we do.
Thank you, Gandhi.
Thank you. You're welcome. Have a
Thank
great
you all.
Thank
I'll
you
go
all.
on.
Bye, Moa.
Bye-bye.
Bye, Ms. Pickett.
All right.
Bye, Lee.
Bye, Sandra. Nicholas, good to see you. Bye, Craig, Tasha, other people who I don't know, but glad to see here. Thank y'all for popping in. Reverend Carolyn Cole, Aisha Whiting, Ms. Houghton, Doja, I see you. Thank you. Jean Lee, Lavinette. Hey, how you doing? Didn't see you up there. Glad you were here. Miss Ballou, you're gone now. Okay, thanks to everybody. Y'all have a good evening.